keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
My name's Heather Mullins, and I'm the Regional Epidemiologist and STD Supervisor here at the Sullivan County Regional Health Department. And today I'm going to talk about STD Awareness Month and the importance of public awareness about STDs in individuals in our area. So the Centers for Disease Control and Prevention has identified the month of April as STD Awareness Month. And this is an annual observance that they have dedicated to the public awareness of the importance and the impact of STDs on individuals across America. And the importance of preventing, treating, and testing for STDs, or sexually transmitted diseases. So of course, this is something that impacts everyone, but our target population is really the 15 to 24-year-old age groups. That's where we see our highest numbers of STDs. And typically when we talk about STDs, we want to talk about chlamydia, gonorrhea, syphilis, and HIV. 3 of those are bacterial infections, and then of course one is a viral infection, which is HIV. So our highest numbers right now in Sullivan County are in the chlamydia and gonorrhea numbers. And of course, like I said, our highest population is typically the 15 to 24-year-old age groups, but it can impact anyone regardless of age, race, or sexual orientation. And what we can offer here at the health department is testing for anyone free of charge for testing for chlamydia, gonorrhea, HIV, and syphilis. 2 of those tests are just a general urine test, and the other 2 are blood tests. Again, we offer that for free to anyone that comes into the health department at either our Blountville location and Kingsport location. Now, the importance of testing and treatment for STDs in a timely manner is very important, particularly for females, in regards to the consequences of not getting treated in a timely manner. For females, we like to think about if they don't get treated in a timely manner, it can lead to pelvic inflammatory disease, which is a pretty painful disease for females. It can also lead to infertility. If those diseases aren't treated, particularly chlamydia and gonorrhea, if they're not treated within a timely manner, that could lead to potential infertility in females. Also for men, there can be some side effects if not treated in a proper or timely manner. That can also lead to some infertility issues with them as well, but that can be completely taken care of here at the health department. Again, we can test for everything, and we can also treat folks for free here at the health department. We also have the ability to, if you're not able to come to us for treatment for specific sexually transmitted diseases, we can come to you. But the thing is, we have to be able to get in touch with you and talk with you and ask you a few questions and then figure out where you're at to bring the medication to you. So treatment for STDs is completely free, is completely important, and it's something that we need to take care of in a timely manner. So let me walk you through a little bit about the process, what that would be like if you came into the health department and you were interested in treatment or testing for STDs. So typically you would come into the health department, they would check you in through the front desk. You would then get to spend some time with one of our registered nurses in the clinic. They would ask you some pretty personal questions, but it's kind of important to go through that information with you to determine what risk factors you may have and just determine basically some health status information about you before they can continue with the testing. So depending on what type of testing you would like to have, we would then do a urine test, and that urine test would test you for chlamydia and gonorrhea. And then we would also do some blood work if you're interested in that, and that blood work would test you for HIV and for syphilis. Now, the important thing to remember is that everything we do in our clinic is completely confidential. So anything you say in those clinic walls will not be shared with anyone else. All that information is strictly confidential between you and the nurse. And then, based on any symptoms you may be having that day, the nurse may go ahead and treat you for presumptive chlamydia or gonorrhea. So she may give you some antibiotics before you leave that day to go ahead and take to prevent you from spreading your infection to someone else. Now, the other person that you may speak with whenever you come in is someone called the Disease Intervention Specialist, and that person is in charge of talking with you about your sexual contacts. They'll talk to you about who you may have been in contact with within the last 3 months to try to determine where you got exposed to the infection. And it's their responsibility to make sure those folks are contacted and informed of their potential contact to an STD and their need to come in for testing and treatment. Again, I want to reiterate the importance of confidentiality. Anything you say to the disease intervention specialist or anything that you say to the nurse is held in complete confidence, and nothing will be shared with your partners other than that they need to come in for testing and treatment of exposure to an STD. Again, I also want to reiterate everything we do here at the health department is completely free when it comes to STD testing and treatment. The medication, the testing, the lab work, everything is covered and completely free. Another thing I think is very important to share is that our current numbers of STDs in Sullivan County are increasing. Our numbers right now of chlamydia and gonorrhea are at a higher rate than what they have been in years past. So we know that there's a lot of work to do to go out there and educate people about the importance of preventing STDs. Your biggest prevention method, of course, is abstinence, but then the second best prevention method is condoms. You've got to protect yourself during sexual activity to prevent the spread of STDs. So condoms will basically protect you from the vast majority of STDs. Condoms are completely free also here at the health department, so you can come through the front door, ask for a brown bag, and without question, the clerks at the front desk will give you what you need in regards to condoms to take with you for free. So again, numbers are increasing here in Sullivan County as well as across the region in Southwest Virginia, so we know the importance of people who need to get tested and folks who need to get treated in a timely manner. Also, I will say that for those who come in and get tested for STDs, and if you do test positive for something, specifically like chlamydia or gonorrhea, and you're a female, what we typically like for you to do is maybe come back in another 3 months to make sure that the antibiotic was able to do what it needed to do and completely clear your infection, and to be sure that you haven't been re-exposed to possibly a partner that we weren't able to get treated. Also, in regards to HIV, if someone comes in and they test negative for HIV and they continue to have high-risk behavior, we recommend that they come in 3, 6, 9, 12 months to retest, just to be sure they haven't had another exposure and to be sure that their body is completely cleared of that infection or that they're negative for that infection. In regards to HIV in Sullivan County, we do know that we have increasing numbers of HIV in our county, and it's important to understand the risk factors for HIV. So we're looking at, of course, anonymous sex partners, but more increasingly we're looking at those who share IV drug needles. So that is becoming a more increasing trend among those who are HIV positive in our area, is just IV drugs and the sharing of needles among friends. The important thing to realize about HIV is no longer a death sentence like it used to be back in the 80s. There are amazing antiretroviral drugs that can treat individuals with HIV. Of course, it can't cure them, but it can certainly treat, and they live long, healthy lives. It's similar to a disease like diabetes, where you take medications and you continue to live a very long and healthy life as long as you continue on your medication. Now, there is a new advancement in regards to HIV prevention, and it's a medication that we like to call PrEP. It's pre-exposure prophylaxis, and what PrEP is it's a pill for those who are high risk for contracting HIV. It's a pill that they can take on a daily basis, and it has been shown to be 95 to 99% effective against preventing HIV disease in those who take PrEP on a daily basis. Of course, it's not a treatment for HIV, but it's another preventative measure that can be used to prevent the exposure of HIV virus. And PrEP can be offered through different providers. If you're interested in PrEP, you're welcome to call here at the health department, 423-279-2856, and tell someone that you're interested in PrEP and would like to know more information about PrEP, and we can direct you to some providers in our area that will prescribe PrEP to those who qualify for that.